It's 9 o'clock, so we're going to go ahead and get started. Thank you all for joining us today, and thank you for the work that each of you are doing every single day to serve Montanans and communities across our state. I know today with us we have participants joining from hospitals, from clinics, from long-term care facilities, from some of our workforce and education partners, our tribal communities, various associations and rural health organizations, and many others who care deeply about the future of healthcare access here in Montana. I really appreciate your time, your partnership, and your willingness to work and engage with us in this as we kick off Initiative 1 of the Rural Health Transformation Program. For any of you that I've not met, my name is Sarah Swanson, and I serve as Commissioner for Montana's Department of Labor and Industry. Before we begin, I do want to introduce several key members of the Department of Labor and Industry team who's going to be helping to lead this work under Montana's Rural Health Transformation Program and the Workforce Initiative. First up, we've got Jennifer Owen. Jennifer serves as the Policy and Public Affairs Director here at the Department of Labor and Industry. She's been instrumental in coordinating this work for us with CMS and our friends at DPHHS, and is really going to be helping overview today Initiative 1, the three sub-initiatives of the funding that the Department of Labor will be rolling out, and she'll be explaining the healthcare employer survey that we released for all of you last week. Also joining us is Mike Parcell. Mike has been deeply involved in workforce implementation planning efforts connected to this initiative, and moving forward, he's going to serve as our program manager here at the Department of Labor for the Rural Health Transformation team. Kayla, I'm seeing some notes in here about folks getting an echo. Do you know if there's anything on our end that you can address, or could you please monitor the chat?
Absolutely. Yes, I am watching that.
Thank you so much. And then finally with us today is Tammy Hickey. Tammy is the Executive Director of Montana's State Workforce Innovation Board, a key leader within the Workforce Service Division here at the Department of Labor and Industry, and the Chief Convener of employers and workforce partners around Montana. Tammy and the SWIB are going to play a major role in helping us to implement the healthcare sector partnerships across Montana that will be key to deploying these dollars. And through her work with the State Workforce Innovation Board, she's also going to help us lead our quarterly virtual healthcare workforce calls so that we continue to have all of your voices at the front of this work moving forward. We also appreciate our partnership with our friends at the Department of Health and Human Services and everyone who's helped move this initiative forward from planning into implementation. We do have Mr. Hermanson and his team here with us so that we can see any input they have along the way, and he will be specifically joining us for the Q&A later today. Today's webinar is really intended to provide a high-level overview of where we are, where we're headed, and how organizations like yours across Montana can participate in this work moving forward. The MOU between the Department of Labor and the Department of Health and Human Services has been executed, so we're ready to kick off Initiative 1 of this work. Jennifer's going to walk us through the details of the three sub-initiatives of Initiative 1 and the employer survey itself. So I want to use my opening remarks to frame the larger picture and explain why the Department of Labor and Industry is so committed to this work. Here at the Department of Labor, we really believe that workforce is not separate from healthcare access in Montana. Workforce is healthcare access. When a rural community cannot recruit a nurse, retain a behavioral health professional, or develop enough frontline healthcare workers to sustain operations, we know that that becomes a healthcare access issue for every family in that community. And in Montana, we know that that challenge is especially significant in our rural communities. Many of our communities are already incredibly resilient, but they're also geographically isolated. In many places, people cannot simply stop working, relocate for several years to complete formal education, and then return home. That's not realistic for many working adults in Montana, whether they're parents, caregivers, or individuals that are already serving in healthcare support roles, but have the skills and interest in upskilling and filling additional roles within the healthcare workforce. That reality is exactly why the workforce development strategies under rural health transformation must look different in Montana. We know we have to build systems that allow people to earn while they learn. We know we have to create pathways that are locally driven and make sense in our most rural and remote communities. And we know we have to ensure that rural communities themselves are part of designing those solutions. That's why this initiative of rural health transformation matters. It's also why the Department of Labor and Industry believes so strongly in the healthcare sector partnerships and in registered apprenticeship models as part of the long-term solution for this initiative. Registered apprenticeship used to be associated only with the construction trades, but in reality, it is one of the most flexible workforce development models available to us today. Healthcare apprenticeship models can support occupations across the entire healthcare continuum while allowing individuals to remain in their home communities, continue working, continue earning while they gain structured mentorship and progressively increase their wages and skill levels as they advance across their didactic education. For rural Montana, we know that matters enormously because if we're serious about strengthening healthcare workforce pipelines, we cannot rely exclusively on systems that require people to leave their communities for extended periods of time with no income while pursuing training. We must build pathways that meet people where they are in the communities where they live and where these vacancies exist. This initiative also gives us an opportunity to strengthen the collaboration between healthcare employers, education providers, workforce organizations, tribal partners, and community leaders across the state. And importantly, this work is not intended to be a one-time conversation. Rural health transformation gives us an incredible opportunity to fund the work that we've been talking about for some time, but today is really the beginning of an ongoing stakeholder engagement process. As our implementation moves forward, we will continue working through healthcare sector partnerships, through quarterly statewide virtual workforce calls for the healthcare sector that will be led by Tammy Hickey and our State Workforce Innovation Board. And those future conversations will help us identify workforce barriers, share promising practices, and discuss funding opportunities. Through that, we'll evaluate the workforce data and trends, make sure we're making the meaningful improvements we need to, and we can continue to work together to align workforce and healthcare strategies statewide. I also want to briefly touch on several important guardrails and parameters that will be associated with this funding and these opportunities because we know many organizations are actively evaluating what level of participation makes sense for them. As part of this initiative, there is a required 5-year service commitment under the federal requirements for anyone who receives a direct investment via scholarship or training dollars. Non-compete clauses between employers and employees are expressly prohibited in this funding, and the funding is not permitted to be used for construction projects. And most importantly, these funds may not be used to supplant any existing funding sources or activities that are underway. These opportunities are intended to expand our capacity and strengthen our workforce system, not to replace existing obligations or funding streams. We also want organizations to understand that the eligibility across Montana is really broad. From the outset, 51 of 56 counties in Montana are immediately eligible for these workforce investments. And in the remaining 5 counties, individual designated rural census tracts will continue to be available as well. So Jennifer will discuss many of these items in greater detail in her section, but before I hand things over, I do want to emphasize one final point. The Department of Labor and Industry and our team really view this initiative as fundamentally partnership driven. We do not believe that our team or Helena alone has the answers to Montana's healthcare workforce challenges. We know that the best solutions will come from employers, from educators, from healthcare professionals and tribal leaders, and frontline providers who are working together to identify what's actually needed in their communities. And we know this might look different in various communities compared to one another. That's why the employer survey that Jennifer is going to review with you today is so important. We need your honest feedback, we need participation, and we need that real world insight from those of you that are on the ground doing this work every day and employing healthcare providers around Montana before we start distributing these funds. The stronger the participation and the engagement, the stronger Montana's implementation will ultimately become. So with that, I'd love to turn it over to Jennifer Owen. Jennifer is the Policy and Public Affairs Director here at the Montana Department of Labor and Industry. She'll provide us an overview of the 3 sub-initiatives of the Workforce Initiative 1, and she'll walk us through the healthcare employer survey that was distributed to all of you last week. So with that, Jennifer, thank you for your leadership on this effort, and I'll turn it over to you.
Good morning. Thank you, Commissioner. Good morning, everybody, and welcome. It is my pleasure to share this information with you. I know, having talked with many of you who are on the call today in the past 3 months, that you have been eagerly awaiting our kickoff on this effort. Want to begin by echoing the Commissioner's tremendous gratitude to our colleagues at the Department of Public Health and Human Services This is a very exciting partnership that we are really pleased to be executing under the framework of Governor Gianforte's 406 jobs. So I'm going to go through at a very high level the details of the Workforce Funding Initiative, which is Initiative 1 of the Rural Health Transformation Program. All of the information that I'm sharing with you, we just wanted to have a conversation rather than death by PowerPoint. All of this information I'm sharing with you is available on the Rural Health Transformation webpage, which is ruralhealth.mt.gov. You can find all kinds of information that the Department of Public Health and Human Services is putting out, the grant information itself, the details on the individual initiative. We'll be dropping some links in the chat as we go through today to help you gather more information. And of course, we'll end today with a pretty extended Q&A session to hear what's really on your mind. But I think it's really important that we understand that everything we're doing today is being implemented on the workforce side under that framework of 406 jobs. So you've been introduced to Tammy Hickey, who is our State Workforce Innovation Board Director. On the SWIB website, swib.mt.gov, you will find the details of 406 jobs. It will help give some life to concepts like sector partnerships, why we're prioritizing health careers, the work that we're doing in apprenticeship, industry recognized credentials. All of those pieces that I'm about to talk about are part of the governor's strategic framework, and we're really excited to be able to lead forward on healthcare first. Our HTP Initiative 1, the Workforce Initiative, is approximately $22.08 million, so a little over $22 million for the first year. It's categorized into 3 sub-initiatives. The first sub-initiative, 1.1, is focused on increasing recruitment of rural healthcare workers broadly. We're going to talk a lot about health career pipelines, building up alternatives, opportunities to train young workers, making young children more aware of career opportunities, really building those long-term local pipelines. And when we talk a little bit later about the employer survey, it's really this bucket of money, these rural healthcare worker occupational pipelines, where we'll be focusing the most of our time and effort in our sector partnerships. In sub-initiative 1.2 is focused on expanding specifically clinical training capacity. And in that area, we're focused on residencies, fellowships, expanding existing slots, and perhaps adding a new pathway for training at the clinical level, at the graduate level inside the state. Sub-initiative 1.3 is focused on the retention and upskilling of the existing workforce. Montana has relatively competitive in terms of low turnover rates. We don't want to dump a bunch of money into recruiting and training healthcare workers and see our turnover rates rise. So we want to, while we are encouraging people to enter the profession, we also want to support them in staying and being successful in that profession and upskilling to bringing state-of-the-art practices into our rural and frontier communities. So 3 sub-initiatives: general workforce recruitment and talent development, graduate level clinical training, and then retention and upskilling of the existing workforce. So let's go through these one at a time. The first sub-initiative 1.1 is focused on increasing recruitment of rural healthcare workers. That's a little over $17 million for the first year. In general, this is a broad category of funding that allows us to partner with you in those local community pilots, which we call sector partnerships, to develop the occupational pipelines that matter most to your community. That ranges from medical to dental to behavioral health to public health. We want to work with you to understand what matters. As you come to be familiar with 406 jobs and the governor's strategy, it is an industry-led implementation focus for our entire state workforce system. And the Rural Health Care Transformation Grant will be implemented in the same way. We want to talk to the people who are on the ground and let them focus our attention and our efforts on the occupations that matter most. These funds can be used for anything from middle school career exploration to high school career preparation to actual ongoing training, short-term industry recognized credentials, apprenticeship pathways, college training programs, anything that we need to recruit and retain the professionals that build our rural healthcare workforce. We will take a portion of these funds and use them to also help attract people to the state. At the end of this conversation, I'm going to talk a little bit about some specific occupational metrics that we have. And for some of those, we don't have time within our 5-year grant period to fully train them from scratch. So we're approaching this in a combination of growing our own local workforce throughout the rural areas of our state and attracting healthcare professionals to our state, which again we'll be doing in partnership with our rural and frontier communities. So you'll see a talent attraction strategy as well as a talent development strategy. We are focusing significantly on apprenticeships and short-term credentials for certain occupations. In particular, we're very focused on the 2017 Help Link program that was authorized by the Montana legislature. That program is designed to help people who are on Medicaid expansion move into the workforce, into sustainable employment. And we're going to carry that out in the Rural Health Transformation Program as well. So we'll be working with our partners, our local sector partnerships on the ground to identify those folks who are primed to move into entry-level careers like peer support specialist, medical assistant, community health worker, all of those areas where we really start launching people into their healthcare careers. In addition, we want to see HOSA chapters expand around the state. We want to see high school and middle school students getting into those career awareness programs, again, across sectors, medical, dental, behavioral health, and public health. So we will be working with AHEC on expanding their pipeline programs, growing HOSA chapters. We'd like to add 20 in the first year, working with schools to develop health career pre-apprenticeship programs that are recognized by the state so that we're moving in that direction of portable, stackable credentials that empower workforce development. And we'll be hearing from you as to what occupations matter. So we want to see a lot of partnerships around the state, but we also understand that these dollars need to be locally driven. So again, that's about $17 million. Think of it as a broad bucket of occupations designed to focus where communities truly need to grow their rural healthcare focus. Some of those dollars, as you heard from Commissioner Swanson, will have a 5-year service commitment attached to them. That is a federal requirement. It is not in our hands. DLI and DPHHS have been working together closely to develop a set of definitions and criterias that we hope that the Center for Medicaid and Medicare Services will approve to allow us to implement a 5-year service commitment in a way that makes sense to Montana. Those service commitments attach anytime someone receives a direct financial incentive. So you're going to hear us have conversations about when it makes sense for DLI to do what DLI does, which is direct support of employees looking for training opportunities, and when it makes sense to partner with employers to build pipelines, to build programs. Those things may not have a service commitment attached to them. So we'll be doing this implementation through a variety of approaches, which include RFPs, mini grants, and direct contract with employees who are receiving training, educational, or employment services. So be prepared for an ongoing conversation and for a variety of methods of implementing these dollars. Sub-initiative 1.2, which is our next sub-initiative, is about $3.9 million. And that's really focused on residency and fellowship training capacity in the state. We'll be doing a lot of partnership with the Graduate Medical Education Council to define what makes sense. We want to expand existing residency capacity. That includes preceptors, that includes supporting institutions in addressing the administrative burdens. Again, we can't supplant existing dollars, but as we grow slots, we want to look for ways to strategize in partnership in ways that make sense for local communities. These do need to be rural residency programs, and we're working to try to define exactly what that means, recognizing that every residency in the state includes some urban rotations, even some out-of-state rotations. So this will be an ongoing conversation on how we can expand on what we have and a feasibility study to see what might make sense going forward. $3.9 million is not enough to build a new residency or fellowship program in the state, but in year one, we'll get started with a feasibility study to see what makes sense for growth in the state of Montana and work with existing residency programs to see where we can expand some capacity. That's largely going to look like contracted out dollars. So be anticipating some conversations around what makes sense and how we partner in distributing that $3.9 million to expand rural training capacity. The last bucket of funds is about $1.12 million. And that's focused on retention and upskilling of the existing healthcare workforce. There's two large categories under here. The first is a little over $700,000. That is the kinds of things that DLI does frequently. It's the barrier busting work that allows people to access employment, education, and training programs without barriers. So that can look like some relocation support. It can look like some very short-term rental assistance, support in books, lab equipment, childcare, transportation, all the things that allow people to access workforce training programs and employment opportunities in their communities if they're facing some barriers to that work. All of those dollars will attach a 5-year service commitment. So thinking through how we do that in a way that isn't burdensome, but still actually drives working professionals into our rural and frontier community is going to be where we're looking for a lot of feedback from our partner stakeholders on this call today. And then the last portion of that $1.12 million is focused on upskilling the existing workforce. That will look like things, team-based care, chronic disease management, using AI and automation to reduce administrative burden and give you more time with your patients. It's all of the things that allow us to innovate and make the work stickier, make it more manageable for people who are entering into the profession. We've heard lots of really innovative ideas in this space, ideas that include things like building statewide referral networks or building statewide consult networks or finding ways to help professionals access peer support so that they don't feel alone and isolated if they are, in fact, the only doctor in a small town in Montana. So we're going to be looking forward to hearing the ideas. Again, because 406 Jobs, and by extension, the Rural Health Transformation, is an industry-led effort, we want to hear from you. What actually solves the problems on the ground? And it's why the employer survey matters so much. We're going to ask you to define your labor markets, define the areas in which you work as a community, and then share with us your priorities. And then we'll have those conversations about how we competitively fund those, support those, and back those. So all of these dollars, this entire year one bucket of $22 million, is focused on largely building a rural healthcare workforce, medical, dental, behavioral health, and public health. But there are certain metrics that we are intensely focused on. And those are the metrics that will help CMS evaluate performance going forward. There are a number of occupations that are identified in the grant, which is again available at ruralhealth.mt.gov, that we will be focused on trying to meet. Some of them we can train, and some of them we'll need to attract to the state. We will be tracking the ratio of APRNs per 100,000 people in rural counties, the ratio of physicians per 100,000 people in rural counties, RNs, dental hygienists, and emergency care providers, that bucket of people that is EMTs, AEMTs, and paramedics. And then the last is PAs in rural communities. So again, our occupational metrics, APRNs, physicians, RNs, dental hygienists, emergency care providers, emergency responders, and PAs. Those are our occupational metrics. Each one of them has a baseline, and each one of them has an annual year-over-year target that ranges anywhere from 2.25% per year to about 6.75% per year. So as we have these stakeholder conversations, we are looking to build a full workforce, but with particular focus on the certain set of occupations that I've mentioned. And then we have two additional metrics. You heard me mention one earlier. We want to maintain our general healthcare workforce turnover at or below the national average. We're below it now. So we want to stay there. As we begin attracting people to our state and moving people into healthcare positions, we don't want to see those turnover numbers go up. And then lastly, we want to improve the overall mental health and well-being of the healthcare workforce in the state. We don't have a metric for that right now. So we don't have a baseline established. That's what we're going to be focusing on in year one. How do we quantify the mental health and mental well-being of our healthcare workforce in the state right now? And then how do we establish a baseline that allows us to go on and measure improvement over time? So you will see as we talk to you about our pilot communities, our sector partnerships throughout the state, that we're going to be engaging some of you in conversations about how we identify mental health needs in the workforce and start showing some measurable progress against them. So that is a summary at a high level of the $22.08 million for year one of the Workforce Initiative, the Rural Health Transformation. There are some workforce pieces in other portions of the grant in initiatives 2, 3, 4, and 5. Those remain with DPHHS, and we're working in partnership with them on that. But I'm not going to address those today. I will leave those for a different conversation. We're focused entirely here on Initiative 1, which is the Workforce Initiative. When you receive the invitation for this webinar today, and it will be, as the commissioner mentioned, we will have standing quarterly meetings where we can come together and hear your questions, your concerns, your feedback, and your input. But one of the things that you received in that email was a link to a survey. We are looking for communities to help us understand how you define your labor market so that we can pull together partnerships where we are working in partnership to address the actual on the ground occupations that you need and barriers to building that workforce, because it's going to look different in every part of the state. So we have a general sense of how the state sort of breaks down in terms of labor markets, in terms of areas where large employers or small employers generally are drawing employees from. But we want to hear from you. So if you haven't looked at that link yet, I'd encourage you to do so today if you can. Please feel free to send questions, comments, concerns. But essentially, we're asking you to think about this survey from the mindset of building a sector partnership. Under the U.S. Department of Labor and under 406 jobs, a sector partnership is all of the relevant players in a particular sector, in this case, healthcare. So in your community, that might look like hospitals, outpatient clinics, mental health providers, dentists, schools, education training providers, a 2-year or 4-year college if it's in your community, a public health officer, everybody who you would consider the healthcare industry. We want you at the table together. We want you identifying the priority occupations in your community that you want to tackle to build the workforce that sustains your facilities and allows us to have a robust rural health workforce. And then we want you to identify to us what the barriers are. What's standing between your community and successful recruitment, training, and retention of health professionals? And that's where we want to direct our RHTP dollars. So as you're looking through this survey, it is a little bit lengthy, but we think these questions are important. We're going to ask you to identify your facility and organization name, where you're at, who your contact people are. Again, we're generally looking to hear from employers, schools, the large and small participants in the healthcare system rather than individuals. But it's also really important that when we talk about sector partnerships, worker voice is represented at that table as well. So whatever that looks like, professional associations, organized labor, groups of employees, a good sector partnership is employers, workers, education and training providers, and all the supportive services coming together to focus on a shared set of priorities. And that's what we want to hear out of this employer survey. So we're going to ask you to define your organizations, the number of employees who are there, and then share with us what you're interested in. Do you want to be a part of a sector partnership? Are you already working with your local your local schools to develop CTE programs in the healthcare space? Do you have a HOSA chapter already? What about apprenticeships? What about pre-apprenticeships? What are your interest areas? What are you willing to work on? We're going to ask you if you have a clinical training site. If you do, that's a separate set of questions. If you don't, that's a separate set of questions. But what we really want to hear is what matters to you, how you define your community. And then we're going to come back to you with some proposals to define pilot communities and provide you some backbone support to convene all of those partners together regularly to develop individual on the ground pipelines that build your workforce. Some of those pipelines are going to align with our metrics because we need your help in doing that. But some of them will be local and specific to your community based on your community needs. So we've said it a lot, and I will continue to stress, this is an industry-led collaboration designed to serve real problems on the ground. This is not the government showing up with a bucket of money and a list of solutions. We have had the opportunity through the great leadership of DPHHS to have the 4th largest award in the nation. And this is our chance to do something really transformational for our rural healthcare workforce. But that only happens if we have the people who are on the ground, the employers, the workers, the educators, the training providers, the supportive services that allow people to get to work and stay there. All of those partners have to be at the table. And we want you to organize into communities that make sense. And then we'll provide you the backbone support. And fortunately, for at least 5 years, some funding to begin delivering on those goals and strategies that you develop on the ground. That's really fundamentally what the pilot community survey is about. That survey will be open for about a week. Please fill it out. Give us your best responses. This is not if you don't fill it out, you don't get money, or if you do fill it out, you absolutely get money. This is the start of our organization of on the ground, real practical development of occupational pipeline and tearing down barriers to work. So we ask everybody to please fill it out, give us your best answers, and know that we'll be back to you for ongoing conversations about, based on these survey answers, how we support your communities in coming together, having some backbone support, and sitting at a table together, medical, dental, behavioral health, public health, to actually build our rural healthcare workforce in a way that lasts and in a way that brings real innovation. There are absolutely strings attached to this money. Those are federal. We'll do our best to implement them in a way that makes sense for the state. But this is our opportunity, we think, to deliver early results and show CMS that they should continue funding in Montana at this or higher levels going forward. So I know that's taken up maybe a little bit more time than I'd hoped. I see lots of questions in the chat. We'll try to answer some live. We'll try to answer others by writing. But Commissioner, before we shift to the last piece of this, I want to give you a chance to weigh in on anything that I might have missed.
Yeah, thank you, Jennifer. And thank you to everyone who's participating today. These questions are fantastic. And thanks to everyone who's already begun engaging with that survey process and these broader workforce conversations with us. We have a lot of work to do. As we move into the final portion of today's webinar, I want to spend just a few minutes and talk about what comes next. Today's not the end of our engagement. Really, it's just the beginning. So over the coming months, the team at the Department of Labor and Industry is going to continue building regional healthcare sector partnerships across Montana with employers, with workers, with stakeholders. That's all of you. And that's part of what this survey is about, is to identify what are those regional or community-based partnerships that make sense so we can support you and gather the correct people in a room to get your input before we move forward. As we begin doing that, we really need that input with employers, with education partners, tribal leaders, all of the workforce and economic development organizations, and healthcare providers. So your survey responses are going to be really important for us. These partnerships are intended to create sustained conversations around workforce needs and solutions, not just isolated grant conversations for RHTP. RHTP is such an important funding opportunity for Montana, but it is just one funding opportunity. And so in our work under 406 jobs and the healthcare sector of the workforce entirely, this work is going to continue to build and grow upon this and hopefully sustain long beyond the RHTP grant funding cycle. Through our team with the State Workforce Innovation Board and led by Tammy Hickey, we will begin coordinating those quarterly statewide virtual healthcare workforce calls. Everyone that is on this call will get that invitation, as well as everyone that is signed up for the RHTP stakeholder list. So it's really important that we continue participating in that way, discussing challenges and identifying opportunities and learning from one another as we deploy these programs. We want these conversations to continue to remain collaborative and practical and action-oriented. How do we get more people in training, qualified, certified, and working in the healthcare facilities around Montana? Because ultimately, our goal is really simple. We want more Montanans to have pathways to healthcare careers, and we want Montana communities to have stronger, more sustainable healthcare workforce pipelines without requiring folks that are unable to leave the workforce to do so, to get those credentials. That really means working together to create those opportunities for people to stay in their communities, strengthening that rural workforce capacity, and reducing barriers to training and employment locally. It means ensuring that all of our healthcare employers have a stronger long-term workforce strategy moving forward, and ways that our department and the work that we do every day is supporting you, not changing direction or doing things that are outside of what the employers themselves are looking for. This initiative aligns directly with our mission here at the department, ensuring that every Montanan has a pathway to a career and a plan to achieve it. We're really grateful to have partners across Montana helping lead this work alongside us and with us. And with that, I'd love to open it up for questions. Kayla, if you could please promote Mr. Hermanson and the DPHHS team as well. Jennifer, Mike, Tammy, and I are all willing to join our DPHHS partners and start answering some of these questions that you might have. If you have a question, even if you've already put it in the chat, if you'd like to ask it live, please raise your hand and Kayla will promote you to ask your question. If we do not get to all the questions in the chats today, we will respond to all of them in writing to everyone on this call. But if you've got a question, please go ahead and raise your hand and Kayla will promote you to kick us off.
Commissioner, while we're waiting for folks to raise their hand, maybe let's answer a couple of questions in the chat. The first one comes from Tobias Wilson. I thought apprenticeships could not require service agreements.
That's a great question, Tobias. Apprenticeships in their own right are a service commitment. When you sign what we call a trade schedule, that contract between a willing apprentice and the employer sponsor for that apprenticeship, they agree to a time-based and a competency-based learning path. That time spent in the apprenticeship is essentially a service commitment, and the time in that apprenticeship counts towards the 5 years required by the Rural Health Transformation Program. So, for example, if somebody joins a registered apprenticeship to pursue a registered nurse credential, that tends to be a 4 year pathway through registered apprenticeship. And so all 4 of those years in apprenticeship will count towards that. And once they receive their full nursing license after passing the NCLEX exam and getting their license from the Board of Nursing, they would only have to complete 1 more year of active service working for a rural health facility to complete their 5 year commitment. I hope that makes sense. I do see a couple of hands raised. Kayla, are you able to start promoting folks?
Sherry should be able to speak. Sherry, are you able to share?
I am, yes. Can you hear me?
We can. Hi, Sherry.
Hi. So just a question, if we're looking at kind of working in a region and group with a collaborative, are you guys looking for each of us to identify our local communities through that survey? Or are you wanting us to all come together and complete that as a whole group?
That's a great question, Sherry. If regional partners like yourself and other area hospitals are fully aligned on all the implementation pieces of rural health transformation, submitting a single survey as a community makes sense. But there's nothing prohibiting you as individuals if you've got different needs in your community, like maybe one community has a HOSA chapter and one doesn't have that middle and high school career exploration piece solved yet. There's no reason you can't submit separately. What we're really looking for in the questions around defining community and defining regions is just as you've described. What is the community that you work with for healthcare? Because ultimately we'll be following your lead as we're establishing these workforce sector partnerships in the healthcare sector. What is the community that makes sense? What is your sector, regionally or community based?
Okay.
But I think as to add on to that, as you're going through the survey, you'll see question 20 is just an open form question that allows you to define your community. If you do choose to have a single representative on behalf of a existing consortium reply, please just note that in question 20 so that we know. But I think the more responses that we see from your community, the more it helps us understand what the needs are. So up to you, but there is sort of free response in question 20 that would allow you to communicate how you're approaching the survey.
So we could even define on that survey, like we are looking at a collaborative, but let's define where we're at in each of our communities. And then later we can all come and group together and we can define that for you on the survey. Okay,
Yes.
thank you.
All right. Kayla, could you promote the next hand raised, please?
Sure, I think Amanda was next.
Awesome. Thanks so much. Hey, this is really, really helpful. We appreciate you. I see a lot of my colleagues from the university systems across the state on today, and I know we've been doing a lot of discussions. I lead our priority for action at UM around behavioral health. So school counseling, clinical psych, social work, and love to hear kind of this discussion because it's exactly what we're doing, right? We're training people in their communities through online programs, keeping them there, able to serve, and of course, get their degree. I think what we're really nervous about, so across campus, we've been being educated on the new limits and restrictions around, loan caps and then the elimination of the Grad Plus loan. And I think what we're seeing is people of moderate or lower income in Montana are really not going to have a path for doing our programs starting very soon, unless they're already in a program. Those loan caps are going to be around $20,000 with no option for Grad Plus loans. And so maybe just like to explain quickly what that looks like is previously, if a social work student had, gotten their loan for the cost of attendance and then got a plus loan, they might get around $17,000 to kind of live on for that semester in a refund. Now they would get, with these new caps and the elimination of Grad Plus loan, they would get $1,075. So that is not not going to be a sustainable, we're going to see dropout and lack of ability to attend. So I'm just wondering, I know that's all very kind of new information. They've only had about, 11 months after the HR1 to plan and implement these changes at universities. So I'm wondering if y'all have been having discussions about that and how might any programs under this initiative kind of help our students?
Yeah, Jennifer, do you want to talk a little bit about how the list of the five priority occupations was developed and where our HTP Initiative 1 is focused in year one?
Sure, I'm happy to answer those questions, but I want to recognize our DPHHS colleague, Amanda Harrow here, who I think helped develop some of those occupational pipelines. Amanda, do you want to start?
We defer to you. Take it away,
Okay.
Jennifer.
Yeah. So the occupational metrics that were defined in the grant, I think, are based on sort of some of you may remember DPHHS conducted a sort of RFI process last fall where people really shared what was happening in their communities and what things were priority occupations. And out of that, the entire RHTP grant was developed, including Initiative One. So those occupations it's critical that we hit them. It's critical we hit those metrics. They are the ones that stakeholders indicated were high priority for the state. Real gaps in our rural area and areas where we think we can make some reasonable progress. There are aggressive metrics. We're told there's some of the more aggressive workforce metrics in the nation, but that's all right because we're going to work really hard to be transformative here. But that said, not every dollar will be directed at those occupations. Some of those we will focus almost entirely on recruitment of professionals to the state. So there is ample flexibility to address these sorts of innovative things that are being raised right now, the specific barriers in a community that are jeopardizing the rural health workforce, whether that's in public health or dental or behavioral health or medical. We have that flexibility to, yes, prioritize our occupational metrics, ensure we hit them, and ensure that the state remains competitive for future funding, maintaining our funding level at least, and if not, growing it over time in partnership with the feds. But please don't hear that just because we have those metrics that we are not open to additional professions. I've seen some questions in the comments about, can we build radiologic technician programs? Absolutely. We hear that one all the time. Surge tech, medical assistant, we hear those. So yes, we want to hit our occupational metrics, but we are not closed off to other occupations. As a refresher, those occupations that are against which our performance is being measured: APRN, physicians, registered nurses, dental hygienists, ECPs, which is four occupations in the emergency response space: paramedic, AEMT, EMT, and EMR, and PAs. So those are our specific occupations against which our progress will be measured. But we also have broad goals for transforming the rural health workforce that extend into many other occupations, which, again, not to be repetitive, is the purpose of these local pilot communities, i.e., sector partnerships, for you to tell us which occupations matter most to your communities.
Thanks, Jennifer. Kayla, could you promote our next question, please?
Absolutely. I think it's Thomas.
Hello, everybody. Can you hear me?
We can.
Good, perfect. Okay. Hi, I'm the interim dean at Torocom, Montana, up here in Great Falls, and we have a lot of medical students here. The whole idea of Toro here is to help increase the healthcare for the underserved. So that's what we're doing with our medical school. We're also in the process of setting up a nursing program, a PA program. We're looking into behavioral health. So we're trying to do a lot of exactly what you're doing. So we really like this idea of what's going on. My question is, like I say, these programs right now are in the beginning stages. It's going to take months, if not years, to get them going. Like, for example, with the PA program, working through ARC-PA may cause some delay with that. So you're talking about year 1 through 5. If we apply for a grant, we don't have fully set up, how long is there a delay that we have, or how much time do we have to get that program going in order to continue with going forward with the grant as we go through each of these four different programs.
Thanks, Thomas. Each year of Rural Health Transformations reporting is due in late August and September, and our performance as a state each year determines the amount of funding we'll receive in years 2 through 5. So year one is going to be significantly compressed. Our first reporting period is later this fall for 2026, and then our performance each year moving forward is determined by how we did in that year period. So truly, when we do issue these funding awards to directly train individuals in these professions in Montana, we do need to show progress each year. Jennifer and our friend Ms. Haro at DPHHS have been actively involved in negotiating these terms with CMS each day. So I'd like to kick it over to them to see if they've got more specifics to share. But I do know we need to show meaningful progress each year as we're issuing funding out to individuals to show their progress towards being trained.
Amanda, did you want to add anything to that?
Understand that these things take time, right? And so appreciate that we will not all meet metrics in year one and that it's a process. And I think, our partners at DLI are primarily responsible for the planning and funding for this initiative. So we will defer to their expertise on, how partners may plan for a long-term implementation across 5 years.
Okay, well, great. Well, thank you. Like I say, I know this is ideal. I mean, it's all, so hopefully we can be working with you very much in the upcoming future because I mean our students are very excited, through different programs that they have as far as working with high schoolers, college students. They really want to get going to help with those areas right now. And then like I say, the other programs, the PA, the nursing, and the behavioral health is going to be coming down the pike. So we can get some started now and then some, like say, in the near future. So thank you very much for working to help get this program set up.
Thank you, Thomas.
Thank you. I think it's
think,
Brian and Jean.
thanks, Tim.
Good morning, Commissioner. Brian Dennis, Boys and Girls Clubs. Hey, Jennifer. Two questions. One, and I apologize, I need to look closer at the survey. It sounds like it's more medical folks focused. Do you think there's value from a club perspective as we think about how we help get middle school and high school kids connected and engaged over the next several years to get them ready for employment? Can we add value to that, do you think, from a
I do
survey
think there's
perspective?
value, Brian. I think that as you go through the survey, you're going to find that maybe not every question ties in directly to the work that you're doing, but I do think your input on behalf of the clubs around the state would be really important in that middle and high school space. So I would encourage you to respond.
Okay, and I can lean on my colleagues to get after it as well and provide their perspective from home. Will that be helpful?
I think that would be helpful, Brian, as we're thinking about these regional healthcare workforce sector partnerships. I would imagine that your experience in Billings might be different than some of the clubs that you have in the more rural and remote communities around Montana.
That's what they tell me.
Yeah, so I think that input would be really valuable.
Okay. And I apologize. Second question. We have been talking about this, and Jennifer, you're aware of some of these conversations. We're looking at it because, a lot of our clubs are smaller. So kind of working it as a statewide perspective and helping those local clubs connect regionally in their area, but providing some support and working all the clubs together. Are you focused just on kind of strictly the community and mini regional approaches, or are you open to looking at a little bit of a broader perspective, especially as it relates to getting, we have 1,000+ middle school, high school kids that we can get to, that we could all work together and try and get them connected locally? That question makes sense.
Yeah, great question, Brian. I think scaling solutions is never a bad idea. But as we work through the regional sector partnerships, we want to make sure those voices are coming out regionally as well. So I think it's a both and, but I would love to invite Jennifer if she has any more to share. But I don't see a reason why scaling a solution using the clubs as a key partner for middle and high school is not a strong opportunity for us in those partnerships.
Yeah, I would echo everything the commissioner said. What we really want to hear locally is the very specific occupations that matter to the local workforce. But the broad awareness of middle school and high schoolers, the early stage career preparation, everything from, you know, job site visits to job shadows to bringing in guest speakers to doing CTE programs to to catalyzing industry recognized credentials under the STARS Act. All of those things that are broadly applicable, they may make more sense in a scalable model. So we want to hear from individual schools as to how they are developing health career programs, where they want to add HOSA chapters. And we want to hear from statewide partners who say we can do this at a larger scale. So the yes and is absolutely the right response.
Perfect. Thank you very
Thanks,
much.
Jennifer. Miss Branscombe.
Thank you much, and thank you for the opening remarks, Commissioner. I think they're right on point, and we appreciate that. We do hear that focus and support the focus of getting survey work from the employer sector and from communities. I also just ask about the vision of really getting associations and the persons that are getting employed. So I do think that's a third layer of a perspective that you're not going to capture in the current perspective of asking employers. I think your individuals that are working in those situations of workforce shortage can give you another perspective or another layer. They can also tell you what systems are doing that aren't working, what employers are doing that adds administrative burdens to their lives that the employers just aren't recognizing, or they have difficulty moving to a more friendly a setting based on regulations and rules. So kind of want to hear your perspective on how we could gain that perspective from physicians and other healthcare workers out there.
Absolutely, Jean. That's a great point. We are counting on you and the other associations representing professionals to also engage in the survey process over the next weeks because we want your input on the front end. And we hope that you'll continue to join us as key members, not only of those quarterly statewide workforce calls that Tammy's going to host virtually, much like this. We'll come back together every month to check in on progress and to hear from you and from the actual workers on the ground. How are we doing and what do we need to do moving forward? But also participating in those regional healthcare sector partnership conversations. We know who most of our association partners are. Always welcome help building out that stakeholder list a little bit more. But you and the other associations representing licensed professionals, we hope you'll continue to join us in each of those moving forward.
Thank you. If you decide to do some kind of a tailored survey too, we certainly offer up.
Okay.
Our database is a survey of every licensed physician, and we have nuanced data that the licensing boards doesn't have and might be helpful in your effort as well.
That's wonderful. Thank you, Jean. I appreciate the offer. Ms. Small Plenty.
Hello, can you hear me?
I can.
Thank you for all the information today. And I'm just trying to, and you may have mentioned this after this survey, what in the rest of 2026, what the timeline looks like for funding opportunities that we as providers, I'm from Bighorn Hospital in Hardin, sorry, will have availability to and to start working on some of the ideas that we have, especially in the area of retention.
That's a great question. Jennifer, do you want to jump right into timelines, please? Or Ms. Haro from HHS?
Yeah, I think the in general, the timelines will be rolling. So when we're providing direct support to an employee who is, or to a potential employee who is looking for a workforce training program, who needs some support to reduce a barrier, who's looking to relocate to the state, we can do that now. We are ready. People can go to any of our 18 job service offices and begin those conversations. If people want to participate in an apprenticeship, if they want to understand what short-term credential opportunities are there, if they want to understand how college and other forms of training might be supported, they can do that today. They can walk in. Those will be individual contracts. They'll have a service commitment attached to them. In terms of RFPs, grants, mini grants, partnerships, those things will be on a rolling basis. The first one that will roll out is the talent attraction and direct recruitment RFP. And then as we hear back from communities, what matters, what they need, then we'll begin working through a blend of those direct worker or future worker contracts, and mini grants out. So you're going to see those on a rolling basis.
Thanks, Jennifer. Rob Stanger.
Yeah, hello. Thanks, Commissioner Swanson and team. This is really useful. And Jennifer just answered some of what my question was going to be, which was really just sort of as, interested parties and stakeholders and folks with various different expertise on this call, whether from the employer, hiring side or from the, education training side on thinking about our healthcare workforce. I'm just curious about sort of opportunities for participation and whether that could be kind of documented somewhere that would be clear for all of us that are actively interested in tracking this work. I've heard that there are some quarterly calls that participation would be helpful, obviously response to the survey, but I think there are many of us that are not quite sure in terms of like kind of some of the direct conversations versus future RFPs. Like, should we wait for RFPs to be announced on the rolling basis, or if we're not part of conversations now, are we kind of missing the boat on helping support you all in doing this work? And I think as much sort of clarity and predictability about future activities would be really helpful so that we can help support all of you in doing this important work, but maybe not be bugging you if like our time is, in year two.
Yeah, thank you. That's a great question. I think in short, go ahead and bug us, to use your words. The next 3 to 4 months are going to be a sprint. And so the more we hear from you, if you've got key information, please share that with us. No engaging or not engaging right now will not give you either a hand up or preclude you from participating in any RFP opportunities. All RFPs and grant opportunities will be publicly posted on the ruralhealth.mt.gov website that DPHHS maintains. So whether you engage with us early and often, or whether you just want to wait for that RFP, it will not impact your opportunity to apply for those dollars. But I would say as we're scaling this program, knowing that the timelines and the rolling nature of it, you are welcome to reach out to any of the folks on this call. That's why they're promoted at the top, so you can put faces with names. Mr. Parcell within the agency is going to be our program manager for our workforce services team. Tammy, that runs the State Workforce Innovation Board. You've heard at length from Jennifer, our Policy and Public Affairs Director, and then Amanda Harrow or Jean Hermanson are their team at DPHHS. I know we would all love to hear from you early and often as we're getting year one going. This is a huge opportunity for Montana, but on behalf of agencies, it's a big lift. And so please feel free. If you see something, say something. We'd love to hear that. And then go ahead and bookmark that ruralhealth.mt.gov webpage, because that's where all RFPs, not only for Initiative 1, but others, will be posted as they become available. I do want to pause there. Jennifer or Amanda, do you have anything you'd like to add to that?
No, not to that. I would like to address, we have just about 3 minutes left. So if folks have a last burning question, please go ahead and get your hand up. But I do want to highlight 2 questions that I've seen. I've seen a couple of versions of could the funds be used to support X? So I saw a mention of Next Nurse. I saw a mention of Atomic Circus. And I want to point you back to the commissioner's earlier comments about supplanting. So if you have an employee in an existing apprenticeship program, in an existing residency program, if you have a student in an existing college course, any of those, we cannot support those. If you choose to make more slots available, if you choose to add a new site for Atomic Circus, or if you bring on a new HOSA chapter, if you grow your apprenticeship program that exists right now from 10 people to 12 people, we can support the expansion and the growth. We cannot supplant what already exists. So that general bucket of questions of, is this program eligible? It is only eligible if it is serving a rural population and if it is an expansion of existing work. And then the next thing, Amanda, we've seen a couple questions of how workforce initiatives might intersect with the Centers of Excellence concept under the grant. Do you want to share something about that?
Sure. So just for folks who aren't aware, the Center of Excellence is a part of the RHTP plan that seeks to support financial sustainability for rural facilities. It will involve some experts who can help make some data-backed recommendations for rural facilities and how care might be delivered in those communities. It will not specifically provide funding for workforce development or training, but may lead to some areas of recognition that, these professions are ones that we may need to put more focus on, but it itself will not provide training or workforce development funds. Does that help?
Yes, thanks, Amanda. Well, we are right at time. I know we have a number of additional questions in the webinar chat. We will respond to all of those in writing and share them with everyone on this distribution list. This call was recorded, so this will be available too to share with your colleagues or other folks in the industry that were not able to join us today. And if you haven't already begun, please do begin reviewing the survey that we need to start building out our work plan here. It is due in just over a week, and we would love to see all of the thoughts and ideas that you have submitted to us on that survey. But with that, thank you so much for giving us an hour of your time this morning, and we'll be back with you again very soon.